Hey, my Black Allied Health peeps. This is Sampri bringing you a third installment dedicated to our students that are currently in therapy school or seeking to enter therapy school. So, the last installment I had was talking about how to form good study habits. And one thing I forgot to mention in addition to forming a good study habits, you also want to make sure you create a good line of communication with your professors. I know maybe depending on your class size, it may be hard to really talk to your professor one on one in person all the time, but always, I would say once you enter your program, maybe send the professor an email, introduce yourself, so that they will know that you're actively seeking help as needed. You want the professors to know that you are engaged in their class. And then when you get a chance, try to introduce yourself in person so they can put a face with a name. Because having those relationships with your professors can prove invaluable in times where you are struggling. So I strongly encourage that you do that. So now I'm going to go in and I'm going to talk to you about how to conduct yourself when you are going on a clinical rotation. So I'm speaking from the perspective of a therapist who has almost 20 years of experience. About 15 of my years mostly have been in the long-term acute care setting, and that's where I have had all of my students. I will say that for the most part, I've had very good experience with my students. Some students I felt were stronger than others, but even the ones who weren't strong initially, I felt rose to the occasion. So I'm going to first talk about what you should expect from your CI. One thing you should expect always is professionalism, and they should treat you as a prospective peer. And you are an adult, you've probably held down a job before, so they should not be treating you any less than a professional, because you are a professional, and you will be getting your credentials, you will be graduating, you will be sitting for a license and take a board exam, and you will be out there in the working world, and they need to treat you as such. Another thing you should expect from your CI is to have lines of communication open always. You should never be afraid to approach your CI about a situation. If you don't feel comfortable about doing something, if you need help with something, there should always be an open line of communication. One of the things I used to do with my students weekly is I had like a little form that they filled out, and it would say, okay, some of the new things, it would ask them, so what are the new things you experienced this week? What were some challenges you had this week? What things went great for you this week? What would you like to experience for the following week? And so that way it kind of helped us to foster some dialogue around that. And that way we can continue to work on building that student skills. Another, I'm sorry, I got interrupted by a call, but something else you should expect from your CI. They should not be treating you as a productivity workhorse, okay? You are there to learn, okay? Part of what you're doing will affect productivity, but the primary reason you are there on that clinical site is to learn, okay? So you are not a workhorse, you are not a slave, you are not free labor, you are there to learn, okay? And if you experience anything where you feel like you're being taken advantage of, you need to contact your site instructor immediately. Okay. So let me talk about some things that I expect from my students. And one of the biggest things I expect from my students is to use common sense. Okay. Yes, I respect your clinical judgment. Yes, I respect your book smarts and everything you learn in the classroom. But when you get into the clinical setting, probably about, we'll say, about 80% of the things you do on the floor and how you move will require you to use more of your common sense than your clinical knowledge. You have to have good intuition. Know if something doesn't feel right or doesn't look right to you, it probably isn't right. Know if you see a patient that has a million lines and tubes, that you probably want to try to figure out first how to make the room safe for the patient to move around in and not dislodge a tube. Okay. And if you don't know how to do those things, what do you need to do? You need to ask. There's no penalization for asking questions. We want you to ask questions. If you don't ask questions, I'm going to look at you crazy, because when you're in a new environment and you've never been in that environment before, especially if it's a setting that you really probably didn't want to be in, you are going to feel intimidated. So you need to ask all the questions, and you need to make sure you understand the rationale behind a lot of things. So common sense will get you a long way. I expect my students to be professional. I expect them to show up on time, show up on the days that they're scheduled. Now, granted, there may be some exceptions to that rule. You might need to be off for a certain reason, but we expect, like I said, if you have those open lines of communication, then that won't be a problem. And if you've proven that you're relatively a dependable student, and as long as having a day off here, coming in a little bit late on one day does not interfere with you being able to pass your clinical, and your site coordinator okays it, then accommodations can be made. Okay. Also, we expect you to be able to have respectful dialogue, conversations, and debates. I'm okay if you don't agree with something that I do, but I want you to come to me respectfully. And I'm telling you this from experience. I've had students question some things I do, which I don't mind you questioning what I do. But, step to me respectfully, just like you would want me to step to you respectfully. First, you can pull me aside. If you don't understand something that I'm doing, then, let me know and ask me the rationale as to why I'm doing certain things. Because like I said before, everything that you learn in the classroom will not always apply to your actual clinical setting. Your patients are going to be so different. What you might have learned as typical textbook presentation of a patient with a certain diagnosis, you come out on the field, you're probably not going to see that textbook patient. So your approach is going to have to be different, and it's going to have to be tailored to that patient. Okay. So just really think, hey, I need to be mindful of who I'm working with, and you want to consider all the clinical implications, but you also want to realize that sometimes you're going to have to change how you think about certain things. And we expect you to think outside of the box. Okay. And it's okay if you have something crazy in mind to do, as long as it's safe and it doesn't hurt the patient. I'm willing to try it if you think it might work. Okay. Another thing you want to expect when you are having your clinical assessments done. So I know you guys usually have a clinical assessment that is due like midterm and then your final. Expect to have a lot of dialogue surrounding this. I'm the type of person that I give detailed assessments. If you have a clinical instructor that's only giving you like 1 or 2 word responses to some of those questions that are on the assessments, then I would be very weary about how they're assessing you. You want somebody that's going to give you constructive feedback, because you're only going to learn if you have some constructive feedback, and you're going to become a better clinician when you learn how to utilize that constructive feedback and grow, and you will grow when you use it in the clinical setting. You also just want to be safe. We expect our students to always practice safety. If something doesn't feel right, doesn't look right, you let your CI know so we can address it. Okay, we don't want any of our patients getting hurt, and we don't want you getting hurt, because we need you in the workforce. We need good clinicians out there, so we want you to be safe. Also, just be open. Be open. I will tell you, I had a student who came to me. This was her last clinical, and it really wasn't the type of setting she wanted. She wanted something outpatient. But what I loved about her, that she was open and willing to learn everything she could about the long-term acute care setting. She didn't shy away from doing things just because it wasn't exactly her cup of tea. And then she realized that she liked some aspects of long-term acute care, even though it really wasn't the setting she wanted to be in. And sometimes you might discover, hey, this might be what I want to do, And even if it isn't, down the line, if you succeeded in that setting, that if you had to get a job in that setting, you know how to handle yourself. So just be open, be open and look for opportunities to learn in every direction. So those are my guidelines for conducting yourself in your clinical sites. Um, like I said, main thing is use common sense. Common sense will get you a long way in this profession and in the help in any of these therapy professions. Thank you.